Well, we know that immunotherapy is already the standard of care for almost everyone with non-small cell lung cancer, either by itself or in combination with chemotherapy for patients with stage 4 disease. We know that given as consolidation therapy after chemotherapy and radiation for unresectable stage 3 non-small cell lung cancer, that it improves survival and is the current standard of care. And now we even have evidence for adjuvant treatment after surgery that single agent immunotherapy may improve at least progression-free or disease-free survival from the IMpower010 study. So what we know from things like surgical series is that treating patients earlier when they have curable disease seems to make a difference. And right now, we're not giving potentially some of our most powerful and beneficial treatments with immunotherapy until months after they've been diagnosed and started treatment for stage 3 non-small cell lung cancer patients. The current trials based on the Pacific, the current treatment based on the Pacific study is even excluding people who progress during those 3 months. And so I think there are several potential benefits to bringing immunotherapy up to initial treatment with chemotherapy and radiation for stage 3 patients. One, you may get added benefit by combining it with chemotherapy and radiation, because that's definitely what we see with stage 4 disease. But we also may just benefit from getting everyone the most effective treatment as soon as possible and not waiting 3 extra months for them to progress. And so I'm optimistic about this approach. We certainly have seen now several trials, including the DETERRED study, the NICOLAS study, and the KEYNOTE-799, where we have several hundred patients with non-small cell lung cancer, unresectable stage 3, who've been treated with this approach, who seem to have done well with promising results, although none of them have been randomized against the standard, the Pacific trial standard of consolidation durvalumab. And so really, we don't yet know if this approach is going to be beneficial, but I think over the next few years, as the phase 3 trials read out, I'm hopeful that this will be a step forward for lung cancer patients.